What are the various endo-perio procedures? Because when you have a problem like a perforation or anything which is not repairable in the normal way, that is not the end of the world. Still, you have options. These are the endo-perio procedures like root resection, bicuspidation, hemisection, and all. So you need to know what are the different types of endo-perio procedures. See, this particular case, you have a root, a tooth which is primarily perio lesion with a secondary endo. So the various type of endoperio lesions also you have to know. It could be a primary endo without perio involvement. It could be a primary perio without endo involvement. It could be a primary endo with secondary perio, which is most common. Or it could be a primary perio with secondary endo, like how you see in this picture. Okay. So what are the treatment modalities? So if an endo is needed, we always prefer to do the endo first. So you do the endo first and then go for the perio procedure. So in this perio procedure, the prognosis of that distal root is not good. So what we do is that you remove that distal root. You resect you cut the tooth into two. Since it is a mandibular molar, you cut the tooth into two, okay, and remove the distal portion. So once the distal portion is removed, then you have the mesial portion remaining there with good bone support. So that looks like a premolar now. That can be used to give a bridge to the distal most tooth. See? So you save one root out of the tooth. And this procedure is known as hemisection. This is called hemisection. See? Only one portion of the root is kept. It looks like a premolar. You give a bridge and the case stays. Now, what is root resection? So for mandibular teeth, you can do hemisection and removal of that tooth. You can sometimes you convert a mandibular molar. Sometimes if your lesion is in the furcation area, if you have a grade 4 furcation involvement and you still want to maintain the roots, what you can do is you can do the root canals, okay, after which you can bicuspidate the tooth. Means the molar can be converted to two premolars and a cleansable area under this interfurcation area can be created. So this process is called bicuspidation. Now, for a maxillary tooth, suppose if the lesion is around one particular root, either mesiobuccal or distobuccal, all you need to do is to, after root canal, you can just resect that particular tooth which has the problem. So it's called root resection. See, this particular case, all these cases we have done in our practice. See, you reflect the flap, you can see that the distal root has been cut. You give a cut to the distal root and the distal root is extracted. And the patient has to maintain that area using an interdental brush or some power flossing techniques. And we have long-term follow-up of these cases. Still, it's there in the patient's mouth. Okay, so in periodontal procedures, you have to remember there are three techniques: root resection, bicuspidation, and hemisection. Okay, bicuspidation is done for molars, mandibular molars, divided into two. If one particular portion of the deceased part is removed, then it is called hemisection. For an upper tooth, if you resect the mesiobuccal or distobuccal root, it is called root resection.